Hello class, this is the second part of the first podcast, Introduction to Pediatrics. We were talking about why parents are so fearful of vaccinations. And we talked about the Wakefield Autism Research Study, which former physician Andrew Wakefield published fraudulent research. Also understand that as far as genetic and innovative therapies, these still have ethical and legal issues behind them. So the screenings and the testings and all these things are not always accurate, and the treatments don't always work. So it's our job as the nurse to advocate for our patients and our pediatric patients and our families, okay? Children, even today, they really don't have rights and they really don't have a voice, and it is our job to be their advocates. To help families and to help support our pediatric patients, there are many public programs and services, especially here in Pennsylvania. Understand that Pennsylvania has the extended Medicaid benefits and has approved that. So for our pediatric clients, that is a wonderful thing. They have much more access to services that can help them. It's our job as the nurse to help find those programs that will help our patients. So, for example, WIC, which stands for Women, Infants, and Children. This provides nutrition, food, health education, and has links to healthcare resources for infants younger than 1 year of age. They're the priority. They'll give to children up to 5 who are at risk for nutritional issues, but the priority is infants younger than 1 year. And they'll provide things like formula, milk, bread, cheese, all sorts of things like that for families. I will tell you, WIC is one of the most generous services that we have. As far as I believe almost everyone is eligible for WIC, including just at the minimum getting coupons for formula and things like that. Head Start is a federally funded program that serves preschoolers, including those with special health care needs. So they provide medical, dental, mental, nutrition support. They include exams, immunization, health education, things like that. They can also provide social services. In Pennsylvania, our IU13 is part of our Head Start program. So if you need Head Start program for a preschooler, you will be talking to your area IU13, and they will be coordinating that for you. Medicaid is that health insurance for low-income families. We have CHIP here in Pennsylvania. That's our Pennsylvania program. If you have a client who you think could benefit from CHIP, everybody is eligible for CHIP. It's based off of income, so sometimes there's a fee or a cost, and sometimes, depending on the income, it could be free. What you should recommend for your patient and their family is to sign up on the Pennsylvania Compass program. The Compass site will take all the information and give all the programs that Pennsylvania has that the family is eligible to them. For example, maybe they're eligible for free health care, but maybe also they're eligible for a reduced rate for Xfinity. At this point, we all know that having internet in the home is an important learning tool for our children. They can get Xfinity or Comcast up to $15 a month. If they qualify, they can get reduced costs on heating and electricity bills, things like that. So it's important to steer them towards that PA Compass site. The EPSDT is Early Periodic Screening and Diagnostic Testing. This is another component of Medicaid. It's federally and state funded, and it provides children with physical exams, eye exams, hearing exams, immunizations, lab testing, dental, anticipatory guidance for parents, which we'll talk about in much more detail coming up here, medical treatment for any conditions that they identify, pregnancy care. So that's another important program that Pennsylvania has to offer. There are dental vans, mobile units that drive around to the schools and give free dental exams to our kids if we allow them. There are LGH has something called Child Protect where they give immunizations free. We all know that Lancaster Health Services will give low or no cost physical exams and healthcare benefits. We all have been there as part of NCC and the Nursing Care Center. So there's lots of different resources. These are just some of them that are available. Special needs programs understand that education is by law given for all handicapped people. It is free and it is given to ages 6 through 21. There is that early intervention between 3 and 5 years old. These are also provide for additional services such as speech, counseling, special education, occupational therapy. Included in this IDEIA. This is a federal program, Individuals with Disabilities Education Improvement Act. Included in that act is our IEPs, which are individual educational plans. These are educational plans for that is child specific. The family requests this, and these are kind of accommodations for the child to help them be more successful in school. This is a really good way to help advocate and make sure that your child is being given what they need to be successful in school. Some of us are going to pediatric specialty care. You will notice in the morning or in the afternoon that the children get picked up by Bayada Nursing. They are taken to school and they are brought back. It does not matter of what cognition they are. They are all by law eligible for school. And nursing, collaboration in nursing. This is things that we've already talked about, but the nurse really needs to be knowledgeable about the community resources so that they can advocate for the family and the patient. Knowing how to access the programs and knowing the services offered can really help the nurse educate and support the family more. We talked about preventative, primary, specialty as far as with handicapped children, IU13s, the IEPs, the respite. Pennsylvania used to have a vent trach respite program. They no longer have that. We'll talk about that in class. Long-term, and that's long-term care, like pediatric specialty care, long-term care for pediatric patients. Healthy People 2020. This is geared towards preventative services. Preventative services for pediatric clients are proven to reduce the risk of illness, disability, and early death, and lower medical costs. So one of the primary goals is immunizations, also to lower obesity rates. Obesity rates are estimated to be about 1 in 5 school-aged children, that's 6 to 19 years old, are obese. So preventing obesity in our children helps prevent illness, death, and reduce healthcare costs. Preventing those early comorbidities such as obesity also reduces the risk of hypertension, diabetes, heart disease, sleep apnea, joint problems. And we talked about in class that children who are obese have higher rates of depression and are bullied more by their peers. So preventative health care for children is extremely important. All right, switching gears to child abuse and neglect. Most victims of child abuse and neglect are between 3 months and 3 years old. Remember, children of all ages are subject to abuse, though. There are a number of risk factors. Children who are different, premature, or hyperactive, or are a result of unwanted pregnancy are a higher risk. Parents with poor impulse control, low self-esteem, mental health issues, unrealistic or rigid expectations, and history of child abuse themselves put a child at greater risk. Families that are socially isolated, who are homeless, who have adult partner-to-partner violence, are socioeconomically more disadvantaged, have stress, substance abuse, and have an unrelated male living at the home, also are risk factors for children. There also are some situational events that put a child at higher risk for abuse and neglect. Illness in the family, changes in living status, separation, divorce, things like that. Just so that you're aware of those, put children at greater risk. The Child Abuse and Prevention and Treatment Act, this was originally enacted in 1974. It was made law in 1988. So 1988, I was 12 years old, so there was no law defining what child abuse and neglect was before that time. That's amazing to me, to be honest with you. There are 4 different categories of abuse and neglect. We have emotional, physical, sexual, and neglect. The emotional abuse, as you can see, there's the definition. Understand that words do not leave marks, but they do destroy a child's self-confidence and self-esteem. And emotional and neglectful abuse are 2 types that are very hard to identify. It's really hard to see sometimes, okay? This slide is to, well, let me pause right there. This will be the end of this podcast. I will pick up on this slide and explain its meaning to me, to you, in the next podcast.